Hello, friends. I am delighted to be here with the amazing Maureen McEvoy. Maureen is joining us all the way on Zoom here from Canada. She's coming to join us in Sydney this November. And for over 30 years, she's been guiding therapists and psychologists and social workers and many in the delicate art of working with trauma in couples therapy. So often we sit in the therapy room and feel the weight of couples' stories, especially when trauma shows up between partners. It can be intense, draining, and sometimes a little overwhelming, let's face it. That's why I'm so thrilled to be welcoming Maureen to Sydney for her 2-day workshop, Healing Trauma, Restoring Connection, on the 8th and 9th of November at Crow's Nest Community Centre. This training is eligible for 12 continuing professional development hours with your body, CACFA, ACA, the AAPI, APS and more. It's sponsored by the Australian Resourceful Therapy Institute, which myself and my husband are co-directors. So we welcome Maureen, who has a master's in counselling psychology, so many qualifications, I couldn't put them all down here, a rich history as a registered clinical counsellor and approved clinical psychologist, supervisor, from Canada, and many things more, Imago, Gottman, and so forth. So welcome, Maureen. It's so lovely to have you here.
Well, thank you for the opportunity. It's always a delight to be able to talk about my work and be able to pass the word along. It's very, I'm at that stage in my career where I want to kind of download some of the information. And so I'm so appreciative of the opportunity to come to Sydney. Never been to Australia. I'm very excited about that and share what I've learned over 3 decades.
How lucky for us then. Well, before we get to some of the other questions, I guess the interesting place to start is, how did you come to be doing this work with couples, Maureen?
Ah, well, I am a trauma therapist. I've been doing trauma work since, the late 1980s. And I can do good individual trauma work, but I noticed that it wasn't transferring over into their relationships. And I'm one of those people who does believe that if you want to have a relationship, to have a healthy one is a good marker of recovery. And it wasn't just happening in some ways. So I started to do a little bit of couples work, and I quickly realized that what I learned in graduate school was just not going to cut it.
Mm.
And I am one of those people who believes in lifelong learning. And so I was quite happy to start learning about couples work. And I started with Imago Relationship Therapy. And Imago, you might know, means image, which means it's not by coincidence who we find ourselves in relationship with. And since then, I have done the Gottman training. I've done EFT. I have done the Couples Institute, which is Ellen Bader's work in California. I've done Stan Tatkin's Pact. So I've done a lot of training about this. And so I began to see some couples. I will confess, Philippa, that I thought that this would be a way to get away from trauma hour after hour after hour in my room.
Mhm.
That's not what happened at all. In fact, in all of those years, I think I've been seeing couples now for 25. I have had one couple that didn't have a trauma history between them. And I will confess I hardly knew what to do with them because I'm used to working with much more challenging couples. And so that's been my journey around working with couples is taking my trauma information and then taking my couples training and information and somehow finding a way to bring them together
Mm.
because the couples work I find wasn't enough. We needed to have the understanding of the trauma work as well and bringing them together in a way that works for me and that I have trained a lot of people in over the last couple of decades.
And no doubt it blends beautifully and helps so many couples. And I'm sure everyone listening here will probably going tick. Yes, we thought there wouldn't be much, but I see that so much in my experience, the early experiences, whether it's attachment wounding, etc. the trauma. It doesn't necessarily have to be, car accident type things. There's so many early things that can happen. Wonderful. Thank you for sharing. We're so lucky to have you coming. It's so interesting. So, Maureen, you really have explained why couples need trauma-informed tools today, because I guess things evolve, don't they?
Yeah, two things I would say. One is that trauma comes in a variety of sizes and shapes, and we have big trauma in terms of childhood abuse, and then we have very current trauma in terms of sexual assault or a car accident. But one of the things that the trauma field is trying to grapple with now is neglect, which is so much more invisible or much more quiet. And of course, that has a huge impact on a person's attachment ability. And of course, every single one of us, uh, our attachment adaptation is going to show up in our relationship.
Mm.
Here's a little tip for
Yeah.
all of us who are helpers. Most of us have insecure attachment, and that's part of the push for us to do the work. But it'll certainly show up between the couples. Now, one of the things we know, for example, is that people who've had early traumatic experiences, and I'm talking about physical abuse, sexual abuse, all those kinds of things, tend to have a disorganized pattern
Mhm.
of attachment, which is
Mhm.
going to show up in the room. And that's going to be that very classic, cry for help. I want you to attach to me. I need you, and go away.
Mm.
I don't want anything to do with
Oh,
you.
yes.
Push, pull, push, pull.
Yeah.
And that an interesting thing that the research shows is that, in the general population, disorganized attachment is only about 15%. But in terms of the people that we see, it's more like 80%. So to understand how to untangle that is a pretty important tool to have in your basket.
Oh, so important. And you're keying into absolutely what I'm seeing to neglect, that invisible trauma of abandonment, really. And it's absolutely not at a cognitive level. It's pre-verbal. It's such a physiological response. However, it
Mhm.
plays out with words in a couple. Thank you so much. And that's such an interesting statistic to think about, how disorganized attachment is so common. So I
Mhm.
guess that might lead to my next question. What do you find, given that you are a supervisor of therapists as well, what do you find trauma therapists or couples therapists struggle with the most when trauma shows up with partners?
That's such a good question. I'd say the number one thing, remembering that we are no different than the people we work with, we freeze.
We freeze.
We just get flooded. We try to think about what to do next, and there's nothing coming, and we don't really know what to do because it can get quite charged,
Mm,
especially if you have somebody who's really quite activated. And typically, then the other person is going to be somebody who is less able to show up.
mm,
And so things can kind of escalate very quickly.
mm,
And then you're frozen. What do I do next? I don't know what to do next, right?
mhm, mhm,
And so to have some ideas about how to be able to respond to that, particularly have some ideas about how to explain to the couple what is going on.
mhm, mhm,
Help them to understand that this isn't particularly unique to them as a couple, and
mm.
therefore the fact that they're struggling is a sign they should break up,
Yes.
but more about being able to have a sense of being able to roll your chair in and say, okay, everybody, let's just slow down for a moment.
Mm,
Let me see if I can help you to understand what's happening right now. Okay.
mhm,
I think the other thing that therapists really struggle with is how slow the work is.
mm,
It feels like you're treading water a lot and that you're not getting anywhere.
mm,
Maybe treading water in circles. But there's good reason why trauma survivors have learned to be very, very cautious around relationships, especially those who've experienced betrayal trauma. And so we have to have an appreciation of all their various ways that they have made adaptations, that they protect themselves, and all of that, so that we can understand why the work is so slow. And it's not because of us, it's not because we're incompetent,
mhm.
it's because this is the nature of the work.
Oh, that's so helpful. And even that reminder, Festina Lente, to hasten slowly, because it can be quite, really challenging work, seeing these patterns that kind of show up off every time there's traumatized couples, and there are so many. I see them, and having some words, the way you said that so eloquently, I'm already learning. Sure. Thank you. I can't wait. And normalizing this isn't, they're not alone, and
Mhm,
knowing how to have some tools that they can you can use. So
mhm.
speaking of tools, what are the models and approaches that inform your work, Maureen?
Well, when I started, fourscore and 10 years ago, it feels like some days, all we had was art therapy and hypnosis. So that's what I trained in. And those show up a lot in my work. And then, of course, EMDR came along and the many offshoots of EMDR. So I bring that.
Yes.
And then, the field started to say, we should really pay more attention to the body, that, um, CBT is not going to be all that we need. We need some additional things that are what in the field they call bottom up, uh, or what they would often call somatic approaches. So I have done the full training in somatic experiencing. I've done the full training in sensory motor psychotherapy. And so it helps me to be able to um, understand what's going on both those kind of levels. So as I was saying earlier, I sort of integrate them in a way that I think that if any of the founders of any of these models were to look at me, they would say, what is she doing? And then they'd watch for a while and they'd say, well, I don't know, but it's working, right?
Yes.
And
Yeah,
so
yeah,
I've
yeah.
given myself permission to bring all of my knowledge into the room with me when I'm working with couples.
Well, thank goodness for that, because I'm sure all those founders will be going, how wonderful that you're able to apply so many trauma-informed models. And I'm just really appreciating, Maureen, that vast range. Art therapy and hypnotherapy and EMDR, I could hear it in your voice. You've got this calming voice. I was thinking that, and so many other rich therapies to draw from, somatic experiencing and so forth. We are in for a treat.
Well, and then I'll also state the obvious, which is to bring all of the Gottman research. I mean, there's such gold in his information about couples. And to be able to sort of explain to a couple, well, the relationship bank account is very overdrawn. And here's the 5-to-1 ratio. And so let's focus on getting some good positive things going. That kind of information, right? And helping people to just be reassured that
Mm.
what they're dealing with is pretty typical.
Yes, so reassuring, and absolutely right with the Gottman's marital research. It just helps they're not alone in this, as you're saying. Fantastic. Thank you so much. And I can't, yeah, I was with a couple yesterday, exactly that. There was so much in the Four Horsemen,
Mm,
and
hmm
and I joked with them, but they needed like a 20-to-1 ratio of positivity.
hmm
Yeah, and their little 4-year-old, interesting, all their trauma was around 4 years old. Their little
hmm
4-year-old's going, oh, mum, mummy and daddy, I want us to be nice. And they got the impact this is having already on the intergenerational patterns of their
hmm
experiences
hmm
playing out in their current family. It's so fascinating, isn't it, too?
Yeah.
Yeah. And I guess yeah, have you got a brief story, a little exercise that you might share?
Well, I can give an example of how this might work.
Yeah.
Um, I was working with a couple, a heterosexual couple. He had very argumentative, critical parents, and his adaptation was to withdraw. And then he really actually kind of got to the shutdown place. So if people understand polyvagal, they would know that he went into that dorsal place.
Hmm.
She, on the other hand, was much more activated, much more in the sympathetic energy. And she was the one who was bringing the information of what she wanted to change. And again, here's a Gottman thing where Gottman says that complaints are good,
Mm.
but
Mm.
criticism is not. And so she came one day and the two of them sat down and she was highly activated. And she basically threw out all the good rules of soft startup and, Imago teaches us to ask for a dialogue, for example. She threw all that out and she just jumped in to saying, things have got to change. I can't stand it anymore, et cetera, et cetera, et cetera. And he visibly shrunk in the chair.
Wow.
And then she said to him, see, you don't even care. You're not even responding. In which case I did roll my chair in to talk to them and said, let's just take a breath. Both of you together. Let's breathe out a little longer. That sigh breath out.
Mm,
Once I had a sense that they were a little bit more regulated, I said, could I give you an alternative explanation about what's going on here? She
mm,
said, yes, yes.
mm, mm.
I explained that what she was seeing in action was him dissociating,
Yeah.
pulling away and leaving the room, so to speak. He wasn't really present. And, I did a quick look at him and I could see that he was now interested in this. And so I did a little bit about explaining how when things are too hard and we have to shut down, we go away mentally. And that's what I could see him doing. And I said to him, does that make sense to you? And he's nodding. And I said, does that start to make some sense to you? And she said, this changes everything.
Oh,
Good. Now, let's take a couple more easy breaths. And now we're going to rewind the tape. Bzzz. How about I coach you, I say to her, about how you can bring this up in a way that he gets to stay present and actually hear you. You willing to do that? And she said yes. And we turned it around.
yes, I can hear that. Wow, that's so fantastic. I'm loving how you're sort of drawing on sort of Dr. Bruce Perry's stuff of regulate before you can even get there. And what I loved, I was writing down, dissociation, what a beautiful explanation. It simply explains what's happening in front of them. And yeah, because dissociation is very common with trauma. Here mentally goes away and you got to see it, and you were able to bring them back very quickly, because that session could have gone south back in, back when you first, yeah, when we early therapists, those ones do, let's face it.
Yes, yes, yes. She would have probably, I would have been frozen. What do I do
Mhm.
here now? Right. And she would have said, that's it, I'm out of here, and, stormed out. And then he would have been looking at me like, what just happened?
Deer in the headlights, exactly. I've
Mhm.
had that couple.
Most of us have,
And
right?
I haven't navigated that well. And it'll
Mhm.
be, so I'm really looking forward to that. And that brings us to our final, well, almost final question. What will therapists walk away with from the Sydney workshop? What practical
Well,
tools?
my marker of a good workshop is that I have some practical tools that I can use on Monday morning.
Exactly.
So that's going to be my focus, is really wanting people to be able to have some ideas about what they can actually do differently. I also want people to have a clear kind of framework. Often we get lost in the trees about all of this, especially with couples where one or both of the partners are trauma survivors. Often they're coming in with the crisis du jour,
Yes.
and we lose our way in that. And so we want to be able to have some ideas about how to work with it. I also want to talk a bit about some strategies about how to do some gentle kind of confrontations that need to be done in those
Yes.
kinds of
Yes.
things.
Yeah.
And I want folks to learn experientially. So we're going to do a little bit of activities that are about us,
Mm-hmm.
uh, using ourselves,
Mm-hmm.
and hope that participants will be willing to do that. We could do, for example, the polyvagal maps and a little bit about how I've adapted them to work with couples. Um, I have this lovely art therapy exercise called an empathy drawing that, they say a picture is 1,000 words. It really is true in terms of this activity. And it's one that can be done inside, the realm of a session.
Mm-hmm.
Um, and so that's the kind of range that I want people to have in their tool basket when they leave at the end of the workshop.
That's amazing, because that suits everyone hearing this. I'm sure ticking all my boxes. It's practical, it's experiential. I'll be able to use it in my next couples session. Wow, that I love that. And you do learn, and we're a therapist. You got to know the stuff yourself to embed it, to impart it. Fantastic. That sounds very wonderful. And my final question is, why are you excited to bring this training to Australia, Maureen? What's
No, I several reasons. One is I've always wanted to come to Australia, so this is a little bit on my bucket list. Also, because I'm at that stage in my own career where I am wanting to download some of the information that I have learned, sort of pass on the legacy. And I'm very excited to meet with some of the practitioners in Australia. I have a sense that there's a pretty strong creative therapy community who would teach me some things as well. And so it's important for me in this stage to be able to share. And I'm delighted, Philippa, that you're creating the opportunity for me to be able to do that.
Thank you. We are also delighted, and you're so right. There's a really wonderful community of caring therapists, psychologists, social workers, OT, art therapists there that are going to be drawn to this amazing workshop. So thank you so much, Maureen. Yeah, we're very excited to be hosting you. And so, friends, imagine that 2 full days will give you so many practical experiential tools that you'll be using. This is your chance to feel calmer, clearer, and more resourced the next time trauma shows up in your in the couples room. So join us in November the 8th and 9th, Crow's Nest Community Centre, beautiful centre, for the Healing Trauma Restoring Connection workshop. Seats are limited and they are expected to sell out quickly because we're so lucky to have an international guest from Canada with Maureen and her vast array of experience coming in. Imago, Gottman, Pact, you've heard it, art therapy, somatic experiencing. Wow. So you've got to get in before it goes. And if Sydney is within reach for you, make a weekend of it because it's a lovely place, Crow's Nest. Invest your practice and your time. We know being in private practice can be a lonely experience at times. If that's your experience, come join and make community. Maureen wants to meet you. So you can also, if you can't make it, you can transfer your ticket. There's group bookings. I will send a link down below in the chat there and you'll be sharing more. You're welcome to reach out to me, Philipa Thornton, co-founder of the Australian Resource Therapy Institute, where we're sponsoring Maureen coming out fantastically. And we're looking forward to more international presenters and sharing more wonderful things. Thank you so much, Maureen.
Oh, thank you, Phil. It's been a pleasure to chat with you about this. I'm very excited now.
Wonderful. We hope to see you soon, everyone.